The American Public Health Association is the premier association for public health professionals, championing the health of all people in all communities. Thousands of public health professionals and advocates are coming together in Atlanta to engage, collaborate, and grow. And APHA TV is bringing it all straight to you. Welcome to the 2023 APHA Annual Meeting and Expo. You're watching APHA TV. All this week, we'll be sitting down with experts in the public health arena and those at the forefront of the fight against threats to our collective health and wellness. And right now, we're joined by APHA President Chris Chanyasulkit. Thank you so much for being here today.
Thank you. It's my pleasure.
And so talk to us about how exciting it is to be here in Atlanta.
I'm thrilled to be here in Atlanta for the APHA annual meeting. I wait all year for this. We're going to have nearly 13,000 attendees, part of my public health family, here to celebrate all the great work that we've done, to share, to learn from each other. We have literally hundreds and hundreds of scientific sessions, but we also have all those meaningful moments, those coffee connections, those socials, those funds, the reception. I can't wait. It has everything.
This is going to be so exciting. Thank you again so much for being here. And Chris, like we said, we will have much more with our current APHA President, Chris Chanyasulkit, and coming up in just a little bit as well. There's a lot more to get to today on APHA TV.
There's so many amazing women in public health who are doing some of the things that folks are struggling with in the field. So we thought this would be a great opportunity to bring those leaders together, talk about lessons learned, challenges, successes, opportunities for growth.
Straight ahead today, we will visit the Women's Leadership Institute as attendees find their voice and expand their influence as a leader in public health.
Together, we can rewrite the narrative to ensure every person's choices are respected, their voices are heard, and their futures are empowered.
We will kick off our tour of the organizations and institutes making incredible strides in the quest to solve community health issues. Plus, as promised, we continue the conversation with our APHA President, Chris Chanyasulkit, about what's ahead in the week and year to come. APHA TV is covering it all from Atlanta, and we want to make sure you never miss a minute. You can always find the latest APHA TV episode playing on the TVs throughout the convention center, on the in-house channels at several of our partner hotels, on the APHA website where you can click through the video playlist to find even more exclusive meeting content, and on our YouTube and X pages, formerly known as Twitter. We get started today with a trip to Texas to highlight an initiative that is changing the way Texans think about health. The Texas Accountable Communities for Health initiative is centered on the healthcare system and values health equity and multi-sector partnerships.
Episcopal Health Foundation created TACHI, and we've invested over $8 million in startup funding to really catalyze community-driven solutions to address non-medical drivers of health across Texas.
The work of TACHI provides a structure for changing how a community creates conditions for health and how power can be shared.
In the Austin-Runberg ACH here in Travis County, we are uniting non-healthcare and healthcare partners to address neighborhood stability and food access in North Austin.
Here in Bastrop County, our ACH initiative addresses the social determinant of health and economic stability.
We're from Brazos County, Brazos Healthy Communities, and we focus on pregnant women with anxiety and depression for our ACH.
In Greater Northside Houston, our ACH Communities East Salud is partnering to improve community health by addressing access to healthy foods, active living, and access to care.
We are Williamson County Accountables Communities for Health, and we're building a network of community health workers.
Now to our continued conversation with APHA President Chris Chanyasulkit. We appreciate your time this morning, so welcome.
Thank you.
So tell us first off, talk to us about what you all have been going through like the past year.
So the American Public Health Association, like all public health across our nation, it's been tough, right? We have the COVID-19 pandemic, but we are, I think, stronger and more fierce and ready to continue the good work and build upon this new awareness of public health, I would say.
There are certain obstacles that we're trying to overcome in public health. Talk to me about that.
So unfortunately, there's misinformation, disinformation, trust issues, communication. We know that in public health, we're working on it, but everyone should know that we are at APHA a trusted source. We've been here for 150 years. Our policies are evidence-based. We are a membership organization of nearly 50,000 members if you include our individual and affiliate members. And we're here doing the work on the ground and across the nation to influence public health for the better so that everyone can be healthier, happier, and that we have a kinder, more inclusive, more welcoming, more just world.
That's amazing because this is a pivotal year for you all. Talk to me about the theme this year and how did y'all select that theme?
So our themes are actually selected by our executive board and our governing council, our membership, and we let them decide. We're a member-driven organization. What does this year and what does it mean to you? And they decide, and that's the beauty of this organization. We are member-driven. What's important to them, what their advocacy is, that's what's important to us at APHA.
Okay, so what can we look forward to this year, APHA, and everything? Are there highlights that you want people to know about?
Okay, I'm so excited because this is my presidential year. I have been going all across the nation talking about how we need to play, read, and vote for health. And so that is being infused throughout these next few days. We'll have Read for Health lounges. We'll have a number of scientific sessions on the positive impacts of voting on health. And for me, we'll have lots of options to play. We'll have play lounges, we'll have trivia night. I'm gonna be there with my own team. We have it all, but we also have 12,000 attendees from all across the world and the nation convening here to get together, to have these connections, to make these friendships, to build stronger friendships, to learn about each other and the good work that we're doing. And honestly, it's a celebration. For me, APHA annual meeting is hands down the biggest public health party of the year, and it's my family reunion, my public health family reunion.
That's amazing. Anything else you want to say or want people to know about what they should know for this year's big event?
When you're here, be in the moment. Enjoy every moment of this. Enjoy the big sessions, enjoy the scientific sessions, enjoy those moments when you're waiting and getting a cup of coffee, turn to the next person next to you. Make a new friend, because honestly, I started here and my first meeting I was a student and I've been here ever since, and I can't even begin to describe, because we don't have enough time for it, how meaningful it has been for me, the friendships that I've made, and really the family that I have now. And a lot of it all happened here in this magic of the annual meeting.
Well, we appreciate your time again. Thank you so much. Again, this is APHA President Chris Chanyasulkit, and we appreciate everything. We're so excited about this year's big event, and thank you again for your time.
Thank you.
Mississippi State University Extension's Aim for Change project is creating community coalitions to solve health issues alongside local champions. Let's head to campus.
At Mississippi State, our Aim for Change project that is funded through CDC is to equip local communities with the tools that they need to increase opportunities for physical activity and enhance access to healthy foods.
So our department approaches its work on two key principles, I would say. One is craft, and the second is community engagement. Our students are very well equipped at figuring out how something can get built, and so doing that is understanding what the human experience is of that object. And because of that, we're very involved with communities.
The collaborative part of it is once we found out that the extension was basically interested in the same thing we were, that was a basically slam dunk to get things done.
What we're going to do, it's going to be largely dependent on what the community wants to do.
Collaboration is the solution. Be able to actually go out into the community and see what the problems are and actually work together to solve them.
Without working with others, we would be really ineffective.
If we're doing it together, it's going to be better. They really believe in being better together.
Project Retain at Tulane University is pioneering a transformative approach to combating burnout among healthcare providers. And recognizing that isolated self-care and administrative interventions often fall short in addressing the profound challenges that healthcare professionals face, Project Retain advocates for a holistic, whole-person strategy.
Burnout is a major problem for the healthcare industry. The mission of Project Retain is to create regional and national capacity for healthcare workforce retention and overall well-being. The future of the healthcare industry and creating healthy workforce environments requires a variety of tools.
Project Retain is making videos and trainings to help increase the resilience of the workforce.
Using wearable AI, part of what we can push out are what are referred to as low-intensity interventions that folks can use to help regulate stress in the moment as it's happening.
Collaboration is a huge part of addressing burnout. A big focus of Project Retain is making sure that we reach as many providers as possible, providing communities of care.
Project Retain is part of that solution that is creating a healthier nation.
At this year's Women's Leadership Session, attendees are uncovering their greatest strengths as part of the Intimate Leadership Institute. Let's see how these like-minded professionals are engaging, collaborating, and growing as public health leaders.
It is less about what you know, and it is more about what you think, about the things swirling all around us. That's what people need to know. That's what people need from us as leaders.
I am so excited about our first Women's Leadership Institute. You know, 69% of APHA members are women. And so we have this wonderful community of women. And this is such a great opportunity for us to provide networking and support and tips for success to our fellow women in the American Public Health Association.
There's so many amazing women in public health who are doing some of the things that folks are struggling with in the field. So we thought this would be a great opportunity to bring those leaders together, talk about lessons learned, challenges, successes, opportunities for growth. I'm a woman, I have an administrative role in my college, and so whenever I can give back to other women, I find it very rewarding and, help people up the ranks. So I felt like this was another great opportunity to build on what we're already doing.
People who say they wish they could be brave or courageous don't realize that they really already are. Things they've done, ways in which they've shown up, has already manifested that courage.
There's plenty of evidence to talk about how women lead, how we lead a little differently. So what we're hoping is that we're starting a movement to provide encouragement, to provide tips for success, and most importantly, to really support our emerging leaders as they really begin their journey and continue.
Being a founder means that you see things that other people don't see, but you still believe it's there. Being a founder means when someone says, no, we can't, we just don't do it that way, I say, well, that's the problem. Now let's move towards the solution.
Hoping the women that attend this institute know that they're not alone, know that they have resources, there's lessons that they've been able to learn and even share their lessons with others. I really want them to walk away with some tools for their toolkit and a renewed sense of purpose.
We've had tremendous response. We're sold out tickets today. So that says to me that it's meeting a need. It is my hope and dream that we've started something here that will become an every year part of what APHA offers to its women. Wouldn't that be fantastic? All 69% of our members who are female to be a part of this discussion.
The Association of the American Medical Colleges Center for Health Justice has launched CHARGE, an initiative focused on bringing academics and public health experts together with communities experiencing a greater risk of adverse health outcomes.
At the AAMC Center for Health Justice, we say that health equity is our goal and health justice is our path.
CHARGE is a group of people that we usually tap into to develop our work and our program.
It's a wonderful way to convene bright minds, experts, individually as organizations, but collectively as a nation to address inequities that continue to plague our country.
Charge is a community collaborative of health equity experts, but we look to collaborate across organizations and across programmatic silos.
To learn more about Charge, you can visit our website at aamchealthjustice.org. You can sign up for our newsletter, and anyone can join Charge.
Not only are you connected in a network of practitioners and researchers, but there are definitely opportunities to get access to data sets, get connected to people that can serve as consultants on your work, and then just ongoing professional development.
There's an ambitious plan underway in Hawaii to help the island leaders prepare for the future. APHA TV introduces you to the Health Policy Initiative based out of the University of Hawaii at Manoa.
This is such a dynamic time in our world with so many changes. We need strong research, data-driven approaches, but also approaches that address caring for our communities, their mental health and well-being. And that's what the Health Policy Initiative is all about.
The Health Policy Initiative is a collaborative effort across the University of Hawaii, working with partners both in other colleges as well as being housed in the College of Social Sciences. We work with nonprofit organizations, state agencies, and federal agencies to move health initiatives forward.
This type of collaborative, multidisciplinary approach, I think, is the future of science.
You know, Hawaii is different than the mainland, and our solutions are going to be different as well. Our population is different, our context as an island society is different, and so we need to tailor approaches to really fit our people, and that's what the Health Policy Initiative is all about.
Let's discover the APHA Center's inspiring mission to empower Black women and girls. The center champions reproductive rights and drives innovative research on HIV awareness and prevention.
The APHA Center works to make sure that all women, non-binary, trans, all women on the spectrum understand and know that reproductive rights and reproductive justice is a human right.
We believe in the wholeness of a person, and so we recognize that Black women and girls' reproductive health choices are very much so intertwined with their overall well-being.
Collaborating with a place like the APHA Center that's already here on the ground, it allows us to move resources from the institution like academia back to the community. So whether it be having funding, to be able to hold some of these healing circles, to be able to hear the needs and stories of the community members, those are just some of the tangible ways that we work together to make sure that everyone's needs are being addressed.
By joining the APHA Center in the movement for reproductive freedom for all and HIV support, together we can rewrite the narrative to ensure every person's choices are respected, their voices are heard, and their futures are empowered.
That's a wrap on this first day of APHA TV. Thanks so much for joining us here as we highlight the incredible work of APHA and a glimpse of what's still to come this week. If you happen to miss any part of today's episode, you can always find the latest APHA TV episode playing on the TVs throughout the convention center, on the in-house channels at several of our partner hotels, on the APHA website where you can click through the video playlist to find even more exclusive meeting content, and on our YouTube and X pages, formerly known as Twitter. Thanks for your time today. We will see you right back here again tomorrow.